Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the anterior high resolution mode. The area of interest highlighted to us is the lower anteriors, lateral incisors, the central incisors, and the lateral incisor and central incisor on the left and the right hand side. Now moving to the this is the panoramic view. On the panoramic view, we can see that there is generalized horizontal bone loss, which is associated with the anterior segment. We can see that there is an angulated bony defect. We can see that there is calculus attached to the teeth. Moving to the axial view, this is the axial view. On the axial view, we can clearly see that the teeth have single canals. These are the central incisors. This is the mid tooth or the mid root level. We can see that there is minimal or no bone support. As we move more inferiorly, this is where the lower one third of the root starts, and we can see there's very minimal bone. And as we move further down, this is the apical section, and we can see that there is a buccal and an angulated bony defect with the one two with the two two with sorry with the one one sorry, my apologies. This is the 4-1, which is the central incisor. It shows that this has a angulated defect and a buccal periodontal lesion. This is the lower right lateral incisor, which is 4-2. It has relatively better bone support, but again, the bone support is only present in the middle to lower one third. As we move to the central incisor in the lower left segment, the left central incisor also shows minimal bone support and is periodontally compromised. Has a single canal present, which is clearly visible. That there is one singular canal here. The lateral incisor on the lower left hand side also has a bony defect right there, which is clearly visible on the axial section. Now we're going to take you to the transaxial section of each tooth, starting with the lower right lateral incisor. The lower right lateral incisor is visible here. That we can see that the bone support is not very appreciable, but from the middle to the lower one third, it has a singular canal. Moving to the central incisor unfortunately has very minimal bone support, which can be seen absolutely gone on the distal side of the central incisor. And here we can see we've got no bone support, has a singular canal. Moving to the central incisor on the lower left hand side has slightly better bone support, but again only in the lower one third. And if we move to the lateral incisor on the lower left hand side, we can see that it has very minimal bone support, has a single canal, but appreciably we cannot see any proper bone support here. And we can also see calculus deposits on the buccal, lingual, and the proximal aspects. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.